I'm Zurong, and here we are going to discuss on how healthcare can be improved in Malaysia. As reported, there is an increasing concern about the quality of healthcare in Malaysia, where all and sundry are not able to enjoy the privilege of accessing quality healthcare. Therefore, what is the best way to improve healthcare? Shall we start from opinion Kaian?
Yes, let me introduce myself first. My name is Lee Kaian. As for me, I think the best way to improve the healthcare is by lowering the cost of medicine. The cost of medicine needs to be lower so every patient can get this medicine with affordable price. Patients also need to find inertia. If you are taking a medication, discuss with your physician how long you has been taking it, whether it's working, and if it is not taking it anymore. Many people take medication for years without knowing if they are helping in any way. For example, antihistamine, nasal steroid sprays, anti-flu medication are prime candidates for this sort of pharmacological initial. You can avoid this problem by taking to your doctor about a trial period when you start a drug. Get some instruction about signs that would know if the drug is working and see the doctor if it is not. Aside from that, encouraging physicians to strictly limit the budget of each patient care will surely drive down the cost and may even conspire to encourage physicians to improve patient preventative care. With this way, patients will have medicine with affordable and can improve their health without worrying about the price or wasting it. So for me, the best way to improve the healthcare is to lower the cost of medicine. That's all for me. What do you think, Zuro?
Well, for me, I think that education is the best way to improve our healthcare, as education could further our understanding toward medical fields. Education enables us to research and learn different kinds of pathogens that are currently affecting our life. Through deep researching and understanding of certain pathogens, we could know more about its characteristics and most important its weakness. So, we are able to develop an effective medicine or vaccine to combat these infectious diseases. For example, the whole world is rushing to come out with a safe and affordable vaccine to wipe out this deadly virus, which is known as COVID-19. All these are needed through education. In addition, education teaches us to live healthily. People with higher education more often have healthy habits like sport and healthy nutrition comparing to people with low education level. It is because they understand more on how to take care of their health by controlling their eating, amount of sleep, and sport. They understand the importance of leading balanced lifestyle in order to maintain a good mental, physical, and physical body. For example, they consume less oily food, processed food, and junk food, but more into the balanced meal, and exercise frequently, and sleep at least 6 to 8 hours a day. Due to the rise of COVID-19 cases around the globe, precaution of preventing this virus is crucial, as we need to educate the people surround of us on the importance of wearing masks, keeping their hands clean, and practicing social distance. And all these are significant in preventing the transmissions, and all of us should encourage each other to do so for the sake of the community. Overall, education is the most powerful weapon which you can use to change the world, as said by Nelson Mandela. Education is important to everyone so they can live better and healthier lifestyle and make this world a better place to live. To conclude, I believe that the most advantageous way to improve the healthcare is by enhancing our education system, because education can further our understanding toward medical fields, and education teaches us to live healthily. How about your opinion, Charles?
Hi, I'm Charles. By the way, I agree with your point, but I'm sorry that I have to disagree with Kaan's point. For me, a nurse is a healthcare professional who is engaged in the practice of nursing, also important in this case, which means trained nurse is better. Trained nurse better can improve the quality of care. Nurses have proven essential for driving patient satisfaction and are key to quality patient communication and patient safety effort. Besides that, nurses can easily use technology to innovate and care for patients. Nurses are great at using innovation method and technology to deliver the best care of patients. Today's nurses embody this same empowering spirit. Some even take it to the next level, working on the technology side of the profession to innovate patient care. Informatic nurse, for example, work with device and tech developer to help them understand how patients experience the clinical setting so they can create better system and protocol. Lastly, for me, is advocate for and garner trust with patient. Besides the daily responsibility of monitoring patient progress and administering medication, one of the most important roles nurses play in the healthcare is patient advocate. Nurses understand a hospital stay is likely not routine for most patients who often just want to ensure someone is here to listen to them. Where doctor likely make rounds once a day, spending a few minutes with each patient. Nurses are the ones delivering hour-to-hour care, acting as an impacting care and advocating on behalf of patients and their loved ones to another members of their care them. That's all for me.
Thank you, Charles. And how about your opinion, Irfan?
Thank you, Zurong. And Irfan, I think I disagree with Zurong your point, but not just point. Even though there are trained nurses, but there is not enough equipment and facilities in hospital for the nurse to take care of the patient. Now I would like to share my own point. My point is buildings. Hospital buildings also can improve healthcare. It is because the building with good environment can attract the patient. For example, provide more car parking and transport facilities near the hospital grounds to ensure the patients and families easily getting the hospital service. And wards and patient areas should have enough space, exposed light and good views to give patient comfortable place and healing environment. Secondly, provide advanced technology that can help improving management system. For example, using television to show the clinical information and data displayed for the clinician and health promotion message displayed to the patient to ensure the patient gets some healthcare information. Then give more Wi-Fi coverage or communication device to get further emergency contact. Finally, readily staffed facilities such as provide bedroom, shops and restaurant for staff that overworking to make sure the staff get enough energy and good healthy, and to ensure the staff can do their work perfectly and happily. That's why I think the hospital buildings is the best way to improve the healthcare. So, IZWAN, can you share something about your opinion?
Okay, thank you, Irfan. Let me introduce myself first. My name is MOHAMAD AIMAN IZWAN. I'm sorry that I have to disagree with Irfan's points on hospital building. If there are no any quality doctors to treat patients or the facility provided in the hospital is of no uses because the facility are not well utilized. Okay, in my opinion, the best way how healthcare can be improved is must be more doctors. This is because, as we know, day by day, more and more people and the number of patients is also increasing, including our country. Therefore, it is very important for our country to have a sufficient number of doctors to accommodate patients, especially in the current situation where the COVID-19 pandemic is spreading around the world. For example, if we see that if a hospital does not have a sufficient number of doctors, of course, the situation in the hospital will be tense because the assistance given to the patient is quite low and make the disease itself difficult to cure. However, if a hospital has a reasonable number of doctors, of course, help will be obtained quickly and the percentage to recover is quite high. My next point is if we look at the situation that occur in the interior where there is a lack of specialist doctors who can treat patients in emergency situation. This cause the percentage to recover is quite thin because the patient there do not get adequate treatment compared to the place that do have a large number of specialist doctors who of course get the best and adequate treatment. As for me, more doctors is the best way to improve healthcare.
Is there anyone would like to express their opinion?
No.
No, okay. Well, I would like to conclude this forum. Due to the popularity from everyone that agree on Zulkifli, which education is the best way of improving Malaysia's healthcare, as education is crucial in nurturing, fostering, and improving the quality of healthcare, so everyone could enjoy it. To mark the end of this forum, I would like to appreciate each and everyone in participating in this forum. Thank you.